August 28th, 2011 was the day that changed my life. I was at the park with my granddaughter, and she dared me that if I could do everything that she could do, she would be good for me the rest of the day. When we came to the zip line, I lifted her up and she did it perfectly. And when I went to do it, I felt a pull in my neck. The pain was immediate. The pain was so bad, I thought that it was possibly an aneurysm that I was having. Once we got to the emergency room, they immediately did a CT, an MRI, an MRA, and a lumbar puncture. Nothing showed anything for an aneurysm or a bleed in my brain. The headache lasted for about 8 months. Being in the medical profession and working for Michigan Head and Spine Institute, it was Dr. Robert Farhat that suggested that I get injections in my neck, that he thought that a nerve could be pinched in the neck and that he might be able to help me. After the injections, the pain didn't go away, and we knew that that was not the answer. He then did an occipital nerve block, which helped my pain temporarily, and we knew that it was from the nerve that it was coming. My next step was to research on the internet what could be done for the pain for the occipital nerve. And it was Dr. Gilmer who was my answer.
Kathie looked miserable when she was sitting in my office. She looked like she was clearly in pain.
She explained that one of her specialties was peripheral nerve pain, and that she did a surgery to relieve the pain of the occipital nerve.
We can cut the nerve and trace out all the branches of the nerve and remove the whole nerve.
This is the nerve that runs up the back of the head here, and also the branches that came down into the neck there. That's why I was getting so much neck pain and unable to move my neck from side to side. And as Dr. Gilmer explained to me, that she would take out about 3 to 4 inches there so that the nerve couldn't conduct the pain anymore from one end to the other. It would relieve the pain that I was having.
At surgery, we traced all of the branches of the nerve, and the length was about 4 to 5 centimeters. By removing the nerve, her pain completely resolved.
When I woke up from the surgery, in the recovery room, the pain was gone, and it was a miracle. Dr. Gilmer was the answer to my pain, as well as to several other patients that I had been able to talk to.
I think it just shows that we have to continue to question what we believe is untreatable.
It's 6 months later, and I am just pain-free still, and my life is back to normal again, finally.